Welcome, Professor Rich R in here. Do you struggle with lab exam questions, whether that be on ATI, HESI, or Kaplan questions? Don't worry, I got you. We'll go through a few here today, and I'll help you get ready to succeed in your next test. Adult female has a hemoglobin level of 10.8. The nurse interprets that the result is most likely caused by which of these conditions in the client's history? We have 1, dehydration, 2, heart failure, 3, iron deficiency anemia, and 4, chronic obstructive pulmonary disease, also known as COPD. So for this one, we gotta know what is our normal range of hemoglobin. Well, for a female, it's about 12 to 16. So where does this person fall? 10.8, okay. So they're anemic, all right. So we know that now. So which one of these could cause that? Okay, dehydration. Let's think about that test-taking strategy. Let's evaluate all of them. So dehydration, what is that going to do? Think about that vascular space. If they're dehydrated, there's going to be less fluid volume. Okay, so when we draw that out to get the lab test, what is it going to do to our hemo concentration or our hemoglobin there? Well, it's going to be more concentrated because there's less volume. So it actually would probably make it higher, okay? So that's not the correct answer. Heart failure, for this one, well, actually, and this kind of goes for number 4 as well, COPD, the body needs more oxygen. So most likely they're gonna increase the number of hemoglobin that they have to meet the needs of the body to carry that oxygen around. So heart failure is similar. The heart's not working as well, so they're going to increase their hemoglobin level so they can meet the demands of oxygen for their body. So not 2, not 4. So that leaves us with number 3, iron deficiency anemia. That's correct. That's the right answer. We need that iron to help us with the developmentation of the hemoglobin. So that is the correct answer at number 3. This question, we have a client with a history of an upper GI bleed with a platelet count of 300,000. The nurse should take which of the action after seeing these laboratory results? Okay, so we have 300,000. Should 1, the nurse report the abnormally low count. 2, report the abnormally high count. 3, replace the client on bleeding precautions. 4, place the normal report in the client's medical record. So for this one, we got to know, again, what is our normal range? Your normal range is 150 to 400. So 150,000 to 400,000 is our normal range. So again, where does this value of 300 fall? Right in the middle, basically, right? It's going to be perfect. So it's a normal value. So if we look at our answers on this one, are we going to report an abnormally low count? No, because it's not low. Why would we do that? 2, report an abnormally high count? No. Why would we do that? It's not high. Same as the last one. Place the client on breathing precautions? No. Again, why would we do that? They're not going to bleed at this stage, right? Because 300,000 is the normal risk. If there's 600,000, then maybe we could do that. But again, they're not. They're right in the normal range. So number 4 is our only answer that makes sense. Place the normal report in the client's medical record. We're essentially not going to do anything because it is a normal lab value for this patient. APTT, again, as mentioned earlier in the video, if you got there, was for heparin. Okay, so APTT is for heparin. So we're just going to cross that one off. And then let's look at 1 and 2 just to make sure those aren't the correct answers. Prepare to administer an antidote. Well, how are we going to know if we need to give an antidote? Why are we going to prepare something if we don't even know that their PT and INR is too high? So that's not right. 2, draw a sample and type cross-match to transfuse this client. It's a good idea, but the first step we need to do is number 4, is draw that sample of PT INR, and that's going to tell us if we need to get that antidote ready, and 2, if we're going to need to transfuse, give blood transfusion to this patient. So again, the first step is identifying if their PT and INR values are outside of our therapeutic range. So number 4 is the answer.